If your aging dog needs more than just good food, you're probably weighing whether to grab a comprehensive senior multivitamin or invest in targeted supplements for specific issues like joint pain or cognitive decline. The answer? It depends entirely on what's actually going on with your dog. I go by Mariana Vasquez, and I usually spend my time researching supplement needs for guinea pigs, not dogs. But after digging deep into canine geriatric nutrition and consulting veterinary sources, I found that senior dogs face remarkably similar challenges to aging small pets: stiff joints, slower minds, and bodies that just don't absorb nutrients like they used to.
You're listening to Total Pet Parent Podcast. Quick heads up, the voice you're hearing is AI generated, but everything behind it, all the research, the data, the script itself, that's written and verified by real people who actually know this stuff. If you've been listening for a while, thank you. Really, your time matters, and I'm glad you're spending some of it here. If you're new to the show, welcome aboard. We release new episodes every Monday, Wednesday, and Friday, covering all corners of pet care. Today, we're diving into senior dog supplements, specifically how to decide between broad-spectrum multivitamins and targeted single-ingredient formulas based on what's actually going on with your aging dog. Let's jump in. The question isn't really whether your senior dog might benefit from supplements. It's which type actually addresses their particular aging journey. Let's compare what comprehensive multivitamins offer versus targeted single-ingredient formulas so you can build the right plan for your older companion. Now, when we look at multivitamins versus targeted supplements, here's what it comes down to. Comprehensive multivitamins work best for general aging support when your dog has multiple mild issues going on. Targeted supplements are better for specific diagnosed conditions like arthritis, cognitive decline, or a vitamin deficiency confirmed through bloodwork. Cost-wise, multivitamins give you better value if your dog needs support across multiple areas, but targeted supplements deliver higher potency exactly where it's needed, though you'll pay more per condition you're addressing. Multivitamins offer convenience with a single daily chew or tablet, while targeted approaches might mean juggling multiple separate supplements for different issues. And multivitamins generally need minimal veterinary monitoring for healthy seniors, whereas targeted supplements often require blood work or health checks to determine if they're actually working. Let's talk about when comprehensive multivitamins make sense. Broad-spectrum senior dog supplements pack vitamins, minerals, antioxidants, and often modest amounts of joint and cognitive support into one daily chew or tablet. Think of them as nutritional insurance for the aging dog who's slowing down but doesn't have diagnosed conditions requiring aggressive intervention. Most comprehensive senior formulas include glucosamine, usually around 300 to 500 milligrams per dose for a 50-pound dog, plus chondroitin, omega-3 fatty acids with EPA and DHA, B-complex vitamins, vitamin E at about 100 to 200 IU, and antioxidants like selenium and Q10. Products like Nutramax Co-Sequence Senior Maximum Strength Joint Supplement plus Vitamins exemplify this approach, combining joint support with multivitamin benefits in one bacon-flavored chew. Check the link below to see the current price. The real advantage here is convenience for dogs experiencing multiple age-related changes at once. Your 13-year-old Labrador with slightly stiff mornings, occasional confusion about where her water bowl is, and a dull coat benefits from this shotgun approach. You're addressing several mild issues without turning supplement time into a handful of separate pills. But here's the limitation I want you to understand clearly. Comprehensive formulas contain lower therapeutic doses than targeted supplements. A multivitamin might include 300 milligrams of glucosamine, where a dog with moderate arthritis needs 1,500 milligrams daily. The omega-3 content might be 200 milligrams when cognitive support really requires 1,000 milligrams of EPA and DHA combined. You're getting breadth, not depth.
These work beautifully for early-stage seniors, ages 7 to 9 for large breeds, 10 to 12 for small breeds, showing general aging signs but no specific diagnoses. They're preventative care, slowing decline rather than treating established disease. And for dogs already eating quality senior dog food, multivitamins fill nutritional gaps without creating dangerous excesses. One genuine concern, though, multivitamins can mask specific deficiencies that need veterinary attention. If your dog's lethargy stems from anemia requiring B12 injections, a multivitamin's modest B12 content might provide slight improvement while the underlying issue worsens. That's why I recommend baseline blood work before starting any supplementation program. You need to know what you're actually addressing. Moving on to when single-ingredient supplements win. Condition-specific senior dog supplements deliver therapeutic doses of 1 or 2 active ingredients to treat diagnosed problems. This is the path for dogs with moderate to severe arthritis, documented cognitive dysfunction syndrome, or identified vitamin deficiencies confirmed through veterinary blood work. Joint-specific supplements typically contain glucosamine at 1,000 to 1,500 milligrams for a 50-pound dog, chondroitin at 800 to 1,200 milligrams, MSM, or methyl sulfonyl methane, and sometimes green-lipped mussel for anti-inflammatory effects. Dasaquin with MSM for large dogs represents high-potency joint support. Check the link below to see the current price. This isn't subtle support, it's targeted intervention for dogs who struggle with stairs, hesitate before jumping, or show visible pain response when their hips are touched. Many owners following our Senior Dog Mobility Issues Guide choose this concentrated approach when multivitamins haven't provided adequate relief. Cognitive supplements focus on omega-3 fatty acids, particularly DHA, phosphatidylserine, medium-chain triglycerides or MCTs, and sometimes SAMe, which is S-adenosylmethionine. Dogs exhibiting canine cognitive dysfunction, disorientation, altered sleep cycles, house soiling despite being fully trained, need higher nutrient concentrations than any multivitamin provides. Research indicates that DHA doses of 40 milligrams per kilogram of body weight can slow cognitive decline, which translates to around 900 milligrams for a 50-pound dog. Our article on recognizing and managing senior dog cognitive decline explains the behavioral signs that warrant this level of intervention. Specific vitamin supplements address deficiencies identified through diagnostic testing. A dog with B12 deficiency from malabsorption issues needs therapeutic B12 supplementation or injections, not the trace amounts in multivitamins. Same with vitamin D deficiency, which affects approximately 50% of dogs with chronic kidney disease.
The downside? Cost and complexity multiply quickly. A dog with arthritis and cognitive dysfunction and dental disease affecting nutrient absorption might need 3 separate supplements at $30 to $60 each monthly. You're juggling dosing schedules, potential interactions, and a lot of pill pockets. Our Senior Dog Dental Care Guide covers how dental issues affect nutrition. And here's something that frustrated me initially. Targeted supplements require patience. Joint supplements typically need 4 to 6 weeks before you notice improvement. Cognitive support may take 8 to 12 weeks to show behavioral changes. You can't just try something for a week and declare it ineffective, which makes choosing the right supplement from the start particularly important. Now let's talk about why formulation matters more than marketing. Whether you choose comprehensive or targeted senior dog supplements, ingredient sourcing and bioavailability determine actual effectiveness. This matters enormously, and it's where marketing claims get really misleading. Glucosamine comes in 3 forms: glucosamine hydrochloride, glucosamine sulfate, and N-acetylglucosamine. The first 2 show similar absorption rates, but glucosamine hydrochloride contains about 20% more active glucosamine per gram. Many lower-quality supplements use less expensive forms or fail to specify which type they contain. That's a red flag. Omega-3 quality varies wildly. Look for supplements specifying EPA and DHA content in milligrams, not just fish oil. The triglyceride form absorbs better than ethyl ester form, and molecularly distilled oils remove heavy metals. Supplements listing salmon oil without specific EPA and DHA amounts might contain mostly non-therapeutic omega-6 fatty acids, and rancid fish oil, which is common in poorly manufactured products, can actually increase inflammation rather than reduce it. If the supplement smells unpleasantly fishy when you open the bottle, that's oxidation. Chondroitin absorption is notoriously poor. Only about 10 to 15% of oral chondroitin actually reaches joint cartilage in bioavailable form. Higher quality supplements compensate with larger doses, 800 milligrams or more, or combine chondroitin with ingredients that improve absorption. Budget supplements might list impressive chondroitin amounts while using low molecular weight forms that barely absorb. I learned this the hard way with guinea pig supplements. Vitamin C stability is a nightmare in cavi nutrition, and the principle holds across species. Expiry dates matter. Vitamins degrade over time, particularly B vitamins and vitamin E. That bargain bottle of senior dog supplements expiring in 3 months has likely already lost significant potency. Buy from retailers with high turnover and store supplements in cool, dry places, not above the stove or in humid bathrooms.
Look for products with the NASC Quality Seal. That's the National Animal Supplement Council. This third-party certification means the manufacturer follows good manufacturing practices, conducts stability testing, and verifies label accuracy. It's not a guarantee of effectiveness, but it does confirm you're getting what the label promises. Let me be very direct about something that doesn't get discussed enough when it comes to safety. Supplements can absolutely cause harm when used incorrectly, and natural doesn't mean safe. Fat-soluble vitamin toxicity is a genuine concern with multivitamins. Vitamins A, D, E, and K accumulate in body tissues, and excessive supplementation, especially if your dog's regular food is already fortified, can cause toxicity. Vitamin D toxicity leads to kidney damage. Excess vitamin A causes bone problems and liver damage. This is why I genuinely recommend blood work before starting supplementation. You need to know if your dog actually has deficiencies requiring correction. Joint supplements can interact with medications. Glucosamine and chondroitin have mild blood thinning effects, not enough to concern most dogs, but problematic if your senior is already taking NSAIDs or preparing for surgery. MSM can theoretically interact with blood pressure medications. These aren't common interactions, but they're worth discussing with your veterinarian, especially for dogs on multiple medications, as many seniors are. Omega-3 fatty acids at high doses, above 300 milligrams combined EPA and DHA per 10 pounds body weight, can impair platelet function and increase bleeding risk. Again, this matters most for dogs on anticoagulants or facing surgical procedures. Some supplements contain ingredients that genuinely worry me. Comfrey and pennyroyal appear in some natural joint formulas, despite known liver toxicity. Excessive calcium in senior supplements can worsen kidney disease, and many supplements use artificial preservatives like BHA and BHT, which have questionable long-term safety profiles, ironic in products supposedly promoting health. One frustration I share from my small pet supplement experience: palatability additives sometimes cause more problems than the supplement solves. Those bacon-flavored chews achieving compliance in picky dogs, they often contain significant amounts of chicken fat, pork digest, or cheese powder. If your senior has a sensitive stomach or food allergies, the delivery vehicle might trigger digestive upset even when the active ingredients are beneficial. In those cases, unflavored capsules you can open and sprinkle over food, mixed with a little plain yogurt or pumpkin, work better than fighting through flavored chews that cause diarrhea. So who should choose comprehensive multivitamin supplements? Choose broad-spectrum senior dog supplements if your dog fits these parameters.
Your dog is an early-stage senior, showing general aging signs. Slightly decreased energy, minor morning stiffness that works out quickly, occasional confusion, but no diagnosed chronic conditions. They're maintaining good mobility overall and still engage enthusiastically with daily activities. Comprehensive supplementation supports healthy aging without the expense and complexity of multiple targeted products. You're looking for preventative support rather than therapeutic intervention. Your goal is slowing age-related decline and filling nutritional gaps in an otherwise healthy senior. The multivitamin approach works beautifully here, much like a quality senior diet provides appropriate nutrition before specific diseases develop. Your budget constrains how many supplements you can realistically maintain long-term. A good, comprehensive senior supplement typically costs $25 to $40 monthly, while building a targeted regimen for multiple issues might run $80 to $120. If finances are limited, address the most issues possible within your budget. Just accept you're providing modest support across multiple areas rather than aggressive treatment of specific conditions. Now, who should choose targeted single-ingredient supplements? Choose condition-specific senior dog supplements when these situations apply. Your veterinarian has diagnosed a specific condition requiring therapeutic nutrient doses, moderate to severe arthritis, canine cognitive dysfunction syndrome, documented vitamin deficiency, or chronic disease creating increased nutritional requirements. The diagnosis matters here. Don't guess at therapeutic supplementation based on general symptoms. Blood work, radiographs, or behavioral assessments should guide targeted supplementation. Your dog shows significant functional impairment from their condition. They struggle with stairs daily, show visible reluctance to move after resting, become disoriented in familiar spaces, or exhibit behavioral changes consistent with pain or cognitive decline. This level of impairment requires the higher potency only targeted supplements can provide. Following our senior dog health checklist can help you document whether symptoms warrant this intervention level.
You've tried comprehensive supplements for 8 to 12 weeks without adequate improvement. Sometimes dogs genuinely need higher doses than multivitamins provide. If your senior's mobility hasn't improved on a multivitamin containing 400 milligrams of glucosamine, switching to a dedicated joint supplement with 1,500 milligrams makes sense. You've given the lower dose a fair trial. Your veterinarian recommends specific supplementation based on your dog's breed predispositions or medical history. Large breed dogs often benefit from aggressive joint support starting around age 7, even before obvious symptoms appear. Breeds prone to cognitive dysfunction, beagles, terriers, mixed breeds over 50 pounds, might warrant cognitive support supplementation earlier than other seniors. Your vet knows your individual dog's risk factors better than any general guideline. You can commit to the longer timeline required for targeted supplements to show effects, and you're willing to monitor and adjust based on response. This isn't a try-it-for-a-week proposition. You're making a several-month commitment to evaluate effectiveness properly. Let's cover some frequently asked questions. Can I give my senior dog multiple supplements at the same time? Yes, you can combine supplements for different purposes, like joint support, cognitive health, and a B-complex vitamin, but you should always consult your veterinarian first to avoid nutrient overdoses, particularly with fat-soluble vitamins A, D, E, K, and minerals like calcium and zinc. Many senior dogs safely take a joint supplement plus an omega-3 fatty acid supplement plus a specific vitamin their blood work indicated they needed. But the dosing must account for what's already in their food and other supplements to prevent toxicity. Your vet can review your complete supplementation plan, including your dog's diet, to ensure safe, appropriate total nutrient intake without dangerous excesses. How long does it take to see results from senior dog supplements?
Joint supplements typically require 4 to 6 weeks of consistent daily use before you notice improved mobility, while cognitive support supplements may take 8 to 12 weeks to show behavioral changes, like reduced confusion or better sleep patterns. Vitamin supplements addressing specific deficiencies usually show effects within 2 to 4 weeks once appropriate blood levels are restored. If you see no improvement after these timeframes with proper dosing, the supplement either isn't addressing your dog's actual issue or they need a different therapeutic approach. Follow up with your veterinarian rather than continuing indefinitely with an ineffective supplement.
Generally, no. Most senior dog supplements work by providing ongoing nutritional support rather than curing age-related conditions. So, stopping supplementation typically means symptoms return within weeks to months. Think of these supplements like quality senior dog food. They support ongoing health needs that don't disappear just because your dog feels better. However, some situations do warrant discontinuation, like a specific vitamin deficiency that's been corrected and confirmed resolved through follow-up blood work. So discuss your individual dog supplementation plan with your veterinarian, including whether lifelong use is appropriate or periodic breaks make sense. Here's the bottom line. Your senior dog's supplement needs depend entirely on their specific health status, not on marketing claims or what worked for someone else's dog. Comprehensive multivitamins excel for generally healthy early seniors, needing modest preventative support across multiple body systems, while targeted single-ingredient formulas deliver the therapeutic potency required for diagnosed conditions like arthritis or cognitive dysfunction. Start with veterinary blood work and a thorough health assessment before adding any senior dog supplements to your aging companion's routine. This baseline tells you whether you're addressing real nutritional gaps or just enriching your dog's very expensive urine. And remember, supplements support health. They don't replace proper veterinary care, appropriate nutrition from quality dog food, or the weight management and gentle exercise that keep seniors mobile and engaged. The best supplement regimen is the one you'll actually maintain consistently for months and years, not the most comprehensive plan you abandon after 3 weeks because it's too complicated or expensive. Choose the approach that fits your dog's diagnosed needs and your realistic capacity to follow through.
That wraps up this episode of Total Pet Parent Podcast. Thanks for listening all the way through. New episodes come out every Monday, Wednesday, and Friday, so you've always got something fresh to learn. If you found this episode useful, I genuinely appreciate it if you leave a 5-star rating and write a quick review. It sounds small, but it actually makes a huge difference in helping other pet parents discover the show when they're searching for information. And if you haven't already, hit subscribe or follow so you get a notification the second a new episode drops. Take care, and I'll catch you in the next one.